Microsurgical Developments Foundation. Furthering the replacement, reduction and refinement of animal experiments is one of the main goals of the Microsurgical Developments Foundation. The Microsurgical Developments PVC Rat can be used for training advanced microsurgical and various experimental techniques. By using this non-animal training device, one is able to drastically reduce the number of live animals needed. The MD PVC Rat was developed in the light of replacement, reduction and refinement of animal-based experiments by the Dutch Microsurgical Developments Foundation. To master more complicated experimental techniques, for example transplantation of organs, one should be experienced in basic surgical skills, such as the making of running and interrupted sutures, and suturing and knotting procedures in standard end-to-end and end-to-side anastomosis. Most basic skills and experimental techniques are described in the Manual of Microsurgery on the Laboratory Rat, Part 1, General Information and Experimental Techniques, published by Elsevier Science Publishers in Amsterdam. In the abdominal cavity of the MD PVC rat, one finds the right kidney and the urinary bladder. The topography of the main arteries and veins of the MD PVC rat in the abdominal cavity is the abdominal aorta, portal vein, vena cava caudalis, common bile duct, and urethra. In the neck region of the MD PVC rat, we can see the jugular vein, and covered by a small skin flap, the trachea and the common carotid artery. The MD PVC rat gives the possibility of training several anastomose techniques in situ, end-to-end, end-to-side, and side-to-side. It is essential to use the correct suture materials. A 80 or 90 suture armed with an atraumatic, non-cutting, round-bodied needle. The MD PVC rat gives the possibility of training several cannulation techniques. As described in the Manual of Microsurgery on the Laboratory Rat, one can practice the cannulation of the jugular vein, portal vein, renal vein, iliolumbar artery, thoracic duct, and double bile fistula. To improve the sliding of cannulae in vessels, use a small drop of glycerin. The preparation of the cannulae is described in the aforementioned manual. In the portal vein of the MD PVC rat, one can practice the porta-caval shunt techniques, for example the button technique according to Funovic, or the suture technique according to Lee and Fisher. The following transplantation techniques can be practiced on the MD PVC rat: the heart, kidney, blood vessels, and prothesis. Several cannulation and experimental techniques are explained in great detail in a series of 10 videotapes which go with the Manual of Microsurgery on the Laboratory Rat. All parts can easily be replaced by new ones. The vessels are attached to small connective pins which are pushed into the body of the MD PVC Rat. The used and/or damaged arteries or veins are simply pulled from the pins, after which new latex arteries or veins can be pushed over the pins. When necessary, vessels can be fixated to the pins by using a small ligature. Use a 7/0 suture. To help assure a long trouble-free life for your MD PVC Rat, keep it free of dust and use care with aggressive liquids in its surroundings. Clean the model using tap water and a brush. When not in use, store the MD PVC Rat in its carrying case and store latex arteries and vessels in small plastic bags in the dark. Microsurgical Development's Foundation. Furthering the replacement, reduction, and refinement of animal experiments is one of the main goals of the Microsurgical Development's Foundation. We believe this can partly be achieved by improving the skills of workers in, for example, the biomedical sciences.